Every day we're learning that toxic chemicals are contributing to an epidemic of diseases around the world. Every day we're learning that the disruptions in the climate are contributing to a whole host of public health impacts that will be felt by everybody on the planet. And in the context of this environmental crisis, healthcare needs to transform itself to be a force for greater healing on the planet, to not only be concerned with healing its patients, but to be concerned with healing the larger community and the environment that sustains us all.
Many of the significant healthcare issues today are caused by pollution and climate change. Cancer, asthma, infertility, obesity, infectious diseases, all are linked to pollution and climate change. It is incumbent upon us as healthcare leaders to change our own practices to eliminate those pollutants and also to lead other industries.
We're concerned about the care of our patients. We're concerned about the care of our communities. We need to do that in a sustainable way. We think it's a priority nationally for hospitals. And we think there are opportunities both in the quality of healthcare and in the way in which we provide healthcare to reduce costs, to do it in a sustainable way, and to reduce our environmental footprint.
Hospital executives are struggling with a number of issues, but perhaps none so pressing is how to engage in sustainable healthcare. Reducing the environmental footprint of the healthcare system has many benefits to society, and it will ensure the economic viability of our healthcare system for the future.
The United States spends $140 billion each year to treat obesity, $116 billion a year to treat diabetes, and hundreds of billions more to treat other chronic diseases such as cardiovascular disease and cancers. There are many scientific studies, including the most recent report of the President's Cancer Panel, that are making a very strong link between the health of our nation and our people and the health of the environment.
In the course of providing care to patients, healthcare systems contribute to environmental pollution. Healthcare is the second most intensive user of energy in the commercial sector. It produces more than 5.9 million tons of waste annually and purchases more than $106 billion worth of chemicals and chemical products each year. Hospitals are often operated in older structures built with materials containing toxins and hazardous chemicals. These chemicals and toxins, along with cleaners, disinfectants, and other hazardous materials used in the healthcare setting, take a toll on the health of hospital staff.
Hospital nurses have one of the highest rates of occupational asthma in the nation. This affects the nurses' quality of life, as well as contributes to the staff turnover, which incurs additional training and replacement costs, as well as becoming a burden on the community. Reducing the hospital's environmental footprint not only helps improve the health of patients, it helps hospitals recruit and retain staff.
As guardians of the nation's health, hospitals are in the best position to lead other parts of the economy to healthier operations, with corresponding health benefits. Those who are already working to green their hospitals report significant monetary savings that they've achieved through sustainable health care. These savings can be used to reduce operating costs, or, alternatively, directed towards education programs or wellness initiatives that focus on keeping patients healthy. Hospitals engaging in sustainable healthcare have a number of resources available, such as Healthcare Without Harm, the Green Guide for Healthcare, CleanMed, the annual conference for healthcare sustainability, and Practice Green Health, a membership organization specifically for hospitals who are making efforts to develop sustainable operations.
Over 1,000 hospitals have already joined Practice Green Health. We work with our members to provide tools and resources to assist them in designing green buildings and to green their operations. By doing this, we are assisting hospitals not only in becoming leaders in sustainability, but actually helping them to save money.
When we began our sustainability journey at Cleveland Clinic in 2007, one of the first things we did was join Practice Green Health. The tools, the tips, the 10-step guides were a great way for us to get off the ground and keep moving. But it doesn't stop there. The annual awards program has been essential in getting buy-in across our organization and providing sort of fuel to our facilities as they compete for the Partner for Change Awards each year.
Another resource is the Healthier Hospitals Initiative, a coalition of hospital systems that are helping the healthcare sector take a collective approach to developing sustainable operations. The Healthier Hospitals Initiative has set out an agenda for sustainable healthcare, outlining steps hospitals can take to reduce their contribution to environmental pollutants.
The Healthier Hospitals Initiative is a really important undertaking, and Partners is proud to be part of it. We are focusing on a number of different aspects of the initiative, including energy reduction, waste stream reduction, and environmentally preferable purchasing. We're collaborating with some like hospitals and leading the sector forward, and we think there are opportunities here for many other hospitals around the country to join with us in implementing an environmentally responsible, sustainable program.
One of the great pressures in healthcare now is to reduce our costs. Although I believe you can make a great argument for becoming more sustainable and being more thoughtful about your environmental impact on the principles alone, you can also save a lot of money. Our first $2 million we spent on conservation and retrocommissioning of pumps and fans has resulted in a $1.2 million per year savings. That is a great rate of return for any investment that we would make.
Sustainable operations can range from full-scale green building to simple practice changes.
A practice change we made at Kaiser Permanente was with rigid endoscopes. These are devices for minimally invasive surgeries. And we'd been using endoscopes that required chemical sterilization. And we were going through 17,000 chemical sterilization kits every single year. So instead, we've moved to a product that can be steam sterilized, no chemicals. There's absolutely no difference in the quality or performance of the device, and we are reducing the amount of chemicals by 17,000 kits a year. Additionally, this change is saving us $1 million every year.
Behind me is Mass General's new building for the 3rd century. It incorporates many of the sustainable features that we're trying to promote across the Partners system. They include high-performance curtain wall systems, a green roof, rainwater collection systems, high-performance building, energy, and BAS systems. We have a lot of daylight into the building. We have an interior courtyard in which patient rooms open into. We have outdoor healing garden, and we have a lot of green, sustainable materials, rubber flooring, and recycled content in the furniture and interiors.
I had the privilege of being a president and CEO of a children's hospital in San Diego for 26 years, and sustainability and the environment wasn't really even on my radar screen until just the last couple of years. Now it is mainstream. There are things that hospitals are doing today that are remarkable in terms of reducing costs, reducing waste, reducing harm to their patients and families and their whole staff, and making themselves a better community. The time is now for every hospital in America, large, small, urban, rural, to get on board and to really buy into the sustainability agenda. It's really important.
Please use the contact information on the screen to learn more on how you can lead your hospital's sustainability efforts.